Hey, I'd like to welcome you to another episode of Mission Matters. My name is Adam Torres, and if you'd like to apply to be a guest on the show, just head on over to missionmatters.com and click on Be Our Guest to Apply. All right, so today I have Robert Massie on the line, and he's a founder and CEO of BrightStar Care over in Fairfax, VA, and he's also the owner of Eclipse. Robert, welcome to the show.
Well, thank you for having me, Adam.
All right, Robert. So excited to get into today's topic. So the emerging healthcare home revolution. Lots going on ever since the pandemic. Some other things have been maybe sped up a bit. I'm excited to get your vantage point of what you're doing over at BrightStar Care and also Eclipse, and kind of how those two things are intertwined, and also the growth of Eclipse. I mean, just a great time, in my opinion, for healthcare at home, and the revolution overall. But just to get us kicked off, Robert, let's start with our Mission Matters Minute. So we at Mission Matters, we amplify stories for entrepreneurs, executives, and experts. That's our mission. Robert, what mission matters to you?
So the mission that matters to us is providing simple, high-quality healthcare in the home, making it cost-effective, and helping people achieve a better quality of life by staying in the home and not having to move. We're all about quality of life and helping people get the healthcare services they need in the home.
Fantastic. Well, love bringing mission-based entrepreneurs and experts on, really to share why they do what they do, like what gets them motivated, what gets them fired up to go out there and make a difference in the world. So awesome having you on the show today. I mean, just to get us kicked off, so tell us a little bit more about how you got started in healthcare and really on this journey to founding these companies and becoming an owner.
Well, I spent 25 years in corporate America. I had a great career up through my 40s and into my 50s. I was a senior manager with a consulting firm, Big Four consulting firm. I was a vice president with IBM and their software division, and enjoying the international travel. And I started to get a little bit weary of the international travel. And about that same time, my wife's mother, who lived in Florida alone, fell on her stairs and broke her hip. She ended up in the hospital. And if you're part of the sandwich generation, which many of us are, this is a story that is very familiar to you. She was going to come out of the hospital back into her townhouse in Florida. And my wife is the only daughter and was responsible for helping her mother get back home safely and for finding the right in-home care to help her recover. And we thought Florida would be a natural. It's got the second highest percentage of seniors in the country. Certainly they would have it figured out in Florida, and it would be something that we could tap into experts, get the information, the options that we needed, and help her out. We were very sadly disappointed. We found that the in-home care approaches in this country were left a little bit to be desired. We couldn't get the information that we needed. People would tell us kind of their slice of the world, the thing that they did, but not the options that were out there and how to navigate this. There's no college course to help you help care for your parents. So we didn't know anything, and very few people would tell us anything. We made a lot of mistakes. We managed through it, but we really came away feeling that the way that we provide care in the home in this country could be improved. And given that I was getting a little bit tired of the travel, and my father had been a small businessman all his life, and my grandfather as well, it was an attractive option to come back to Virginia. We were in Chicago at the time, and maybe address the needs of in-home care if we could find an approach that fit. So we started looking around. We did find an approach that fit. It was called BrightStar. It had been founded 10 years before. And we had the opportunity to bring it to Northern Virginia. And so we took that opportunity.
Amazing. And I love to hear when, many entrepreneurs, when they get into a business, they acquire a franchise or they start another business, many times to solve a need. And I feel like sometimes one of the most of their own. And I feel like sometimes some of the most successful businesses or stories that I've had on the show they come just from that. So when I hear this story, I'm like, you were solving a problem for your family that you knew that there'd be a lot of other families out there that were maybe having the same opportunity, right? To where they
Yeah.
had the same need that wasn't being fulfilled quite the way that you felt it could be done.
Yeah, and I had the opportunity to see what good in-home care looked like, which was maybe why I was a little bit dismayed at what I found when
Yeah.
we took care of my mother-in-law. I had 3 open heart surgeries from the
Mm.
ages of 22 to 47. I had caught a terrible virus that attacks the heart valves, and I had my aortic valves replaced. And when I returned home each of those 3 times,
Mm-hmm.
because of the insurance that I had, because I was working for large companies,
Mm-hmm.
I had tremendous in-home care. I had in-home antibiotic infusions. I
Wow.
had physical therapy. I had nurses to come tend to the wounds
Yeah.
that you get with open heart surgery. I had activities of daily living supported.
Mm-hmm.
So I had seen what it looked like, what good
Yeah.
in-home care looked like. And then I had seen the experience that we went through, and I figured there's a way to get this done.
Mm.
And we did find a way, fortunately.
As we go further into this discussion of what in-home care is and what it's looked like, and kind of some of the transformations you've seen since you've been part of the industry, or even from before, maybe it'd be helpful just to have you define kind of like what the scope of in-home care is. I don't want to overestimate that everybody's had experiences with this, and so just maybe a little bit of background on that.
Sure. I mean, I think most people, particularly if you're helping to care for your parents or you're a senior, have the experience of what's known as Medicare home health.
Yeah.
Acute system meant to help you recover from illness or injury. There's some home care that is provided and paid for by Medicare. If you're enrolled in Medicare and over 65, it's not a great deal. It's enough to help you get back to baseline and
Mhm.
nurse visit once a week. Maybe some physical therapy, possibly a caregiver to help you with your bathing and dressing
Yeah.
for an hour or so a week. And it does that for 4 to 6 weeks typically.
Mm.
And that's the extent of the coverage. That's
Mhm.
not the part of the business that we wanted to address. Medicare does what Medicare does. It does it pretty well.
Yeah.
Um, it has some aspects of the customer service side that I'm not real fond of, but
Mhm.
we approach the private duty home care, which is filling all of those other gaps when people come home
Yeah.
and they truly need more help than just what Medicare will provide,
Mhm.
and that is very frequent. It also helps provide for people who have needs and they're not enrolled in
Yeah.
Medicare, and they come home from an illness or injury and they need help. We certainly serve all ages, which is a little unusual for this industry, but
Mm.
that's private duty home care, typically paid for by long-term care insurance.
Mhm.
Families pay privately. Some health insurances are now beginning to pay for it. More and
Mhm.
more are beginning to do that. So that's the side of the business that we address.
And so just taking it a step further, when somebody, I noticed that, just to get an idea of the landscape, you mentioned your journey and trying to find the right type of care. Like what are some things that somebody should be thinking about when they're thinking about that? So either they have a family member, just to be more specific, they have a family member that needs some care, and they're maybe in the position that you were originally, where you're like, okay, let's find it. This shouldn't be too difficult. And then they're going through this maze, so to speak. That's what I think of it as, like a maze. Like, do I do this? Do I do that? Like, what are some tools or some things that they should be thinking about when thinking of when trying to find a provider?
Well, the first thing that I would do is you're going to have to find a primer, or
Hmm.
you're going to have to find a partner who can help you understand the options, because they're not intuitive very often.
Hmm.
My wife and I went back to school when we first started into this business. We went and got we're now certified senior advisors.
Hmm.
Think of that as a graduate course in how to help people find the right healthcare,
Wow.
how to manage the finances and the housing,
Hmm.
and deal with the issues that occur when they age.
Hmm.
So you've got to find somebody who can help you through that journey. There are lots of
Hmm.
people out there who can, and there are lots of resources that help you understand
Hmm.
if you want to do self-study. That's the first thing. You have to understand how it works who pays for it. And then you need to do a needs assessment. Like anything else, you've got to figure out what exactly is going to be needed. Your medical professionals will help you with that, right? Your physician, your healthcare team, you've got to identify who those people are. You've got to bring them together. You've got to sort through what the needs are. And then when you understand the landscape and your options, and you have a sense of the needs, and we have a primer that we send out to our clients and to people who are interested, then you can begin to make some decisions and take some steps forward and determine what kind of a provider, which provider, how much service is going to be needed, how much will it cost, what will the schedule be, those kinds of details.
So considering obviously, all that's happening, and for context for people that are watching this, we're recording this in early December of 2021. So going back to considering what has happened, over the last year and a half, I feel like there's a lot of changes, and you have a unique vantage point, both at the helm at both companies. Like, what are you seeing right now that's going on in the industry, like overall?
Well, in 2020, the world got turned upside down, and we all experienced it. And it's no different. Healthcare was turned upside down. No longer could you go to a hospital or an ER room or an acute care or a rehab facility as you had before. You had to really think it through. First of all, there weren't any beds. The COVID-19 pandemic was taking the beds away. Elective surgeries were being canceled. So just gaining access to those traditional routes of healthcare, including your physician's offices, who restricted hours. It was very difficult. So what ended up happening was a pivot to and an acceleration of delivering healthcare at home, because everybody had to stay home. It was the safe place to be. But you needed to continue. If you've got a chronic condition, you need care. If you've got, if you have an illness, you need care. So we ended up seeing a revolution begin to accelerate how, when, and where we were delivering our healthcare services. Everything from infusions for chronic conditions, to cancer treatments, to regular home care, personal care and companion care, as we refer to it. And everyone had to focus on that. It was no longer a luxury. It was no longer a nice to have. It was a must have. And so the entire industry pivoted. I bet your listeners and viewers have had probably their first telehealth experience in the last year or two, right? How many physicians are doing telehealth where they hadn't before? They have maybe toyed with it, but now they're adopting it and it's rolling out. We do telehealth. So that was one dimension. The healthcare information systems ramped up. So now, before you do your telehealth visit, you log in and you provide all this information, and the interconnectivity of these systems has gotten much better. So your physician knows your health history, why you're going to be on this call, what that tells. So we all pivoted to delivering more, better in the home, because we had to.
Yeah. Can you comment maybe a little bit on the quality of patient care? Because I mean, from you see, and because I don't want this to be a blanket question. Meaning, I'm sure for some things the care got better. For some things, maybe there were some tricky points, because this happened very fast. But just in general, can you comment on like the quality or the of patient care just overall, and what you've seen?
Yeah, you had a huge challenge all of a sudden if you were going to have somebody in your home. Because that person, we didn't have vaccines for a full year. Now we have vaccines. Are the people that are coming into your home vaccinated? Are they using the precautions, the masks? Do they mask up? What do you know about the providers that are coming into your home? So it added a layer of challenge to it. I would say in general, the quality of the care has actually gotten a little bit better. Because physicians will now make house calls, right? There are a number of physician practices that have pivoted to actually coming to the house. We have all of our people are vaccinated. That's a requirement in our agency and in our companies. They all mask up. We've met those challenges, and the information and the technology that we've brought into this because of the pandemic in some cases has actually given us greater insight into the quality of the care that's being provided. Good companies provide good care. right?
Yeah.
And then that's more expensive, but you can identify the quality of care pretty quickly. And I would say, in general, it's probably improved a little bit. There are pieces where it's become a challenge. If you don't know when your nurse is going to arrive because they're backed up with 8 other appointments, because they have to see 8 patients. Well, then you've got an agency that's having some struggles, and the quality is not going to be maybe what it needs to be. But you can identify that pretty quickly. You can ask a few targeted questions to get at that. And early on in the experience, you can determine whether or not you're getting that quality. But as I say, in general, I think it's probably actually improved a little bit.
Yeah. Yeah, I would think so. And then obviously there's always the other side of the patient care. It seems to me like it's possible, based on some of the convenience and things like that, that maybe the patients are also more engaged.
Well, certainly if you get your care at home, study after study for 30 years has shown you live longer and you live better. If you stay at home amongst friends and family, you're comfortable. That there's no question that improves the outcomes, and that delivering care at home is a better way to do it. If you can make it cost effective, which can be a challenge. But there is no doubt that the ability to do it is getting more cost effective, and that we are delivering much more in the home, and that is leading to better outcomes for our clients. There are fewer hospitalizations, rehospitalizations. Fall risk precautions have gotten much better, and that's the number one reason seniors end up in the hospital. That and medication management errors, which has also gotten better. So in the home, we can manage things, and the outcomes can be much better in many cases.
So I want to pivot a bit here, and I want to go further into your company. So first off, as you went on your search, and you obviously did your due diligence, you went back to school for this, and you landed upon BrightStar Care in Fairfax, VA, as I know where you're a franchisee. Tell us a little bit more, maybe about the company and why you decided to go with BrightStar Care.
When we started looking around for something, we could have started with a clean sheet of paper, but we were not industry experts. So tapping into a known system would have been better, and into a franchise that maybe was doing what we thought it would work, but we couldn't find very many. There were very traditional, senior-only, personal care and companion-only options out there. But we just got lucky, I guess. We did hire somebody to help us look. And we found this company that started 20 years ago now in Gurnee, Illinois, run by a brilliant woman by the name of Shelley Sun, who had an approach that was different. It's for all ages. It provides personal care, the traditional caregiver at home, or CNA, certified nurse assistant. But it also provides skilled care seamlessly. So nurses, registered nurses, licensed practical nurses, and they're required to do a lot of these things at home. These new services that people are having to take advantage of, infusions, wound care, are nurse services. They're not caregiver or CNA services. And she had that vision of doing that, and had developed it, and we were able to acquire the rights to Northern Virginia of this approach. And it is different, and it has made a difference, and it's broader, giving us more options to deliver these services, and it's a little bit deeper. We are accredited by something called the Joint Commission, which accredits the best hospitals. Most private duty home care agencies do not go to this step of getting accredited and learning and meeting the standards of accreditation. Think of it as the Good Housekeeping Seal of Approval. This particular approach does that. 100% of our agencies are Joint Commission accredited. And so that holistic approach that they were taking fit, and it encouraged the sharing of information, the education of the client and their family. And as CSAs, we had already decided, and we are beholden to do that free of charge, actually. And she had all of those elements in her mission, and so it just made sense.
So tell us a little bit more about the services specifically.
So we provide probably 50% of what we provide is what known as personal care and companion care. This is when you come home, or you're at home already, and you just need help in the morning, getting up, getting bathed, getting dressed, getting your meals made, which is we call it an IADL, doing the laundry, making the bed, running the errands, reminding you to take your medications, making sure that light housekeeping gets done. Helping you up. Many people require help. They use, as you get older, mobility and transferring from bed to chair and chair and walking. You want people to help you and be with you when you do that. You can't drive anymore. You need people to drive you. This is the personal care, companion care side of the business, and that's about 50% of what we do. We provide certified nursing assistants and caregivers who do that as a service, and they come to your home, 1 hour, 1 day a week, all the way up to 24/7, depending on what the need is. And the needs change over time, and you have to be able to adjust them, and we do. But that's kind of the right-hand side of the business, if you will. The left-hand side of the business is the skilled care. More complex needs, infusions, wound care, people who are on oxygen, people who need their medication managed, not just reminding you to take it, but actually dosing the medication. A nurse has to do that. Doing treatments in the home that are increasingly complex and require nurses. We have a medical director who works with us, and my nurses, RNs and LPNs provide those services, and they also go into the home and do that. And that's the left-hand side of the business.
And so taking it a step further, so now obviously you had BrightStar Care, and now you develop Eclipse. Like what brought that about? Tell us a little bit more about Eclipse.
So we've been doing BrightStar now almost 10 years, 9.5 years. And about 3 or 4 years ago, we had it's a very person-centric business where we send people to the home and we provide services in person at BrightStar. And we realized that tended to be a little pricey sometimes and expensive. And B, not everybody needs that. You go through your journey, your healthcare journey in your lifetime, and your independence is something you value. And if you don't need somebody there for medication reminders, then you'd probably rather not have somebody you don't, even if they're a wonderful person and you like them a lot, coming in just to remind you or just to make you breakfast or whatever it may be. What we realized was there was this gap of a period in everybody's life where they needed to know how their healthcare was progressing. They needed to know the status of their healthcare. They needed to be able to get that information to their physician. They needed to have their healthcare team understand it, but they didn't necessarily need somebody to come into their home. And being an ex-IBM person, I understood and realized that we had technologies that could help with that. So we founded Eclipse to do that. Eclipse provides telehealth services, remote patient monitoring services, and helps people understand, kind of what's going on. We're all wearing, an Apple Watch. We get our pulse rate. We know what our activities levels are. We have fall alert bracelets and necklaces so that if somebody does fall, it automatically lets someone know. We have the ability to step on scales and monitor weight, particularly for people who have chronic conditions like chronic heart failure. That's very important. These are passive technological capabilities that exist, that have been developed, that people are using. And if we could focus them on healthcare and filling that gap, we could help people manage their healthcare journey, own their data, communicate with their physicians, and understand when and what they might need. We could do the analytics and even predict to some degrees what they're going to need and possibly when. Fall risk predictors are out there. We can now track movement of people in the homes with passive devices. How much activity, is there in the home? What about the gait? This watch actually measures my gait. And has my gait changed? Am I now more likely to fall than I was before because my stride length is shortened? These are things that can be understood. And Eclipse is primarily a technology company, but plugged into BrightStar and with a call center that can monitor all of the data, trends, alerts, respond if necessary, and inform physicians and the clients what's going on. We felt that that was something that wasn't being well met. And so that's what Eclipse is. That's what Eclipse does. It's about 2.5 years old now, and it's beginning to pick up a great deal of steam.
Yeah, and it seems like just the telehealth side of this alone. I mean, as somebody ages and progresses, through their life, it seems like maybe somebody starts on the telehealth side, and as they age, and time passes, maybe down the line they need some of the in-house care or the in-home care. But then also the monitoring side of things. To me, it seems like just the model overall, when you're thinking about the idea of what, the goal, improving patient outcomes overall, it seems like you're hitting many of the angles.
Well, we are. And as I said, the top two reasons that people end up in the hospital, particularly if you're over 65, are falls and medication errors. Both of those can be addressed and monitored in the home passively. You don't have to do a thing other than open your pillbox. You don't have to do a thing other than wear the watch and step on the scale. And put the blood pressure on. Just add that into your morning routine. And you can start out on this journey, connect into your doctor via telehealth, connect into our nurses via telehealth.
Yeah.
That's the beginning of that journey. It's not hard to do. It's very cost effective, and it just gives you greater control and knowledge and understanding over your own health.
When you talk about the remote monitoring part of things, I don't want to assume that everybody understands the capability of like what that's able to do. So meaning when even things like you mentioned, the monitoring of weight, the gait, like all these different things. Can you talk a little bit about like the idea of what happens when you have that data and how powerful that can be, and maybe some of the things you can prevent?
Right. Well, let's take a scale, since that's one of the simplest. Somebody steps on a scale. That scale is Bluetooth enabled. There's a very simple, just like you have Wi-Fi in your house, there's a simple Wi-Fi collector. It transmits the data of your weight, your BMI, your pulse rate through your feet. Actually, all these things get transmitted and they get captured in the database. The database has parameters in it, built in. First of all, we know whether or not it happened. If it didn't happen, we might call and encourage you, Mrs. Johnson, you might want to step on your scale today. That would be helpful. But when we get the data, we can set guardrails around it, and we understand by person what those guardrails should be. Particularly if you're managing a chronic condition and your physician has said that he wants you to weight below X, you can't gain more than Y in a week period, whatever it is.
So a guardrail, for example, just to make sure I understand that correctly, is it could be a weight range, for example.
So it's very often if you have heart issues that you want to monitor your weight, because that signals, if a weight gain could signal water weight gain, which is a condition called edema, which can be very dangerous for somebody with a heart condition. So if that weight goes up suddenly because of water weight gain and edema, and you don't know the cause necessarily, you want to have a gate on it, and they'll say 1.5 pounds per week. Anything above that, we want to know about. We want to pay attention to, and we want to probably take a follow-up action. And for that person who has that chronic condition. And so the technology can do that automatically. It's all HIPAA protected and encrypted. It can get to the physician either every day or only when it exceeds. Those parameters are very easy to put into place.
And that particular example you're giving, I mean, that could save a life, right? Because what happens is if you're gaining a little bit at a time, like it's not, maybe the patient's not necessarily in pain, they don't notice anything until maybe it's a lot further down the line. But with this monitoring, like that flag or that signal can come up, and that could potentially save a life.
A 1.5, 2 pound gain is almost certainly asymptomatic. Now, there may be other symptoms associated with that weight gain, but yes, it can sneak up on you. It can go undetected. It can save a life.
Wow, it's amazing. I mean, the remote monitoring part of things, it just fascinates me because And, at one point, like you said, we all wear Apple Watches or Fitbits or these things, and just thinking about like heart rate or things, like most of the time when a lot of people talk about remote monitoring, it has to do with maybe exercising or something like that. Like how many steps did I walk today, right? Like that kind of
Right.
thing. But on the other side of thing, it's just so powerful in terms of what it can do on the healthcare side of things, especially as that data is collected over time. It's exciting.
Yeah, we're getting more and more. We can do pulse ox, which is the amount of oxygen in your blood. A very
Mm,
simple device on the end of your finger, which is very important if you have chronic lung conditions.
mhm.
And that can save a life, and those parameters can be set. So we're on the verge of deploying these things, partially because of the pandemic, at
Yeah.
scale in the home, and I think it will make an enormous difference.
Yeah, I'm in. I love it. I think it's a great idea, and I think all of us are going to benefit from this at some point in our life. As just this monitoring side of things. So, I mean, this is exciting overall. So, Robert, I'll just say first off, I mean, it's been great getting to know more about what you're doing at BrightStar Care over in Fairfax, Virginia. Also, Eclipse and what you're doing in telehealth, remote monitoring, like all these things that are combined to really improve the patient experience and in-home care and really just make a difference there. So I have to ask, so what's next? I mean, what's next for you? What's next for your companies?
Yeah, well, we've got a lot of work to do to bring the telehealth and the remote patient monitoring to market at scale.
Mhm.
Um, we're not out of the woods yet. Obviously, we
Yeah.
still have COVID-19. Omicron is coming through. We've got to see what that does. We're going to be staying at home, and we're going to have to increase and continue to increase both the effectiveness and the quality, but also the scope of the services that we provide at home. And I think we'll continue to do that. I
Mhm.
mentioned earlier cancer treatments. Some states are now rolling out cancer treatments at home at
Yeah.
scale, and that was unheard of 5 years ago. We're going to be looking at those new services that we can roll out effectively, and the new technologies that help
Mhm.
people while they're in the home so people can continue to stay at home. We still have, I think, another year or so to weather the current conditions and the
Yeah.
current pandemic. We're going to keep going on the mission and see where it takes us.
Amazing. So if somebody's watching this or listening to this and they want to learn more, I mean, what's the best way for them to connect with you and your team?
So you can go to our website. It's brightstarcare.com/Fairfax.
Mhm.
We have a ability to connect in with our team in real time if you want. You can also call us. Our phone number is on there.
Mhm.
The Eclipse site is eclipse-health.com
Mhm.
if you want to learn more about that, and reach out to us. As I say, we're certified seniors advisors. We took an oath to provide information and options, and all you have to do is reach out, and we'll be happy to talk with you.
And one point of clarification, just to make sure I understand. So for BrightStar Care, that's you're serving predominantly the Northern Virginia area, and I
That's right.
believe. And with Eclipse, what areas are you serving there?
So currently, the state of Virginia and the immediate Mid-Atlantic region, we're rapidly expanding up and down the East Coast,
Mhm.
primarily. We're partnering with some folks in the Midwest and the West Coast, so we hope to be
Yeah.
able to provide services there as well in the next few months. But primarily, Virginia right now is where we have our delivery footprint.
Fantastic, and we'll put all the links to the websites and stuff like that in the show notes so that our viewers can go check it out really easy just by clicking on it. So great stuff there. And to everybody watching, if this is your first time tuning in, at Mission Matters, we're all about bringing on business owners, entrepreneurs, and experts that are really mission based, that really have something to give back and to the market and to their niche of the world. And we bring them on the show and we showcase what they do. So if you enjoyed what you saw today, definitely hit that subscribe button. We have many more mission-based individuals coming up, and we don't want you to miss any of that. And just have to say, Robert, again, it's been a pleasure having you on the show and learning more about your business, your story, and also your journey just in healthcare and the in-home healthcare industry, and just really being a pioneer and innovator there, and just pushing the envelope forward, even like going forward, and even creating Eclipse after you already had a successful business, 10 years or so running already up to that point. So I just love to see when people are pushing the envelope and trying to improve outcomes, which in this case is outcomes for patients. So thank you again for coming on the show. It's really been a pleasure.
Adam, it's been a pleasure, and thank you for the opportunity.